2016, a new LSU Health New Orleans study and LSU New Orleans Children's Hospital study actually as well shows a major measure of diabetes is significantly higher in young Black patients. The findings are published online in the Journal of Diabetes Science and Technology. Dr. Stuart Chalou with LSU Health Pediatric Endocrinology is with us this morning to explain the study, which I personally found fascinating. He and I discussed this in the hallway, but Dr. Chalou, thank you for being with us this morning. Yes, so help us understand what this study was looking at and what it found exactly. I mentioned a major measure, but you can do a much better job explaining that to me.
Hemoglobin A1C is a measure that all doctors taking care of patients with diabetes use and have been using to assess how you're managing your diabetes. And it's supposed to be what your average glucose is. Now we have these incredible devices that can give you exactly what your average glucose is. And we set about to find out how accurate A1C is in assessing what the average glucose is. So now we have this traditional measure that's been used for decades, and now we have exactly what your average glucose is. And we found that in our African heritage patients, hemoglobin A1C, this traditional measure, has been overestimating what the average glucose really is. And it turns out that many reports show that African American patients with diabetes have a higher incidence of low blood glucose. And we feel that it may be because people are assuming that the average glucose is the same at the same hemoglobin A1C. And we're showing that it's not the same, that it overpredicts what your glucose is in African American patients.
So what you're saying is large numbers of African American patients over the decades could have been overdiagnosed or
overtreated,
wrongly diagnosed and
overtreated with insulin.
Wow.
And then leading to low blood glucose reactions.
So overtreatment, which leads to other issues.
Yes.
So I mean, this is a groundbreaking. These are groundbreaking findings. So what could we? I told you, I warned you. We have not much time to discuss this, and this requires a whole lot more time. But what could this mean down the line for diabetes diagnoses and treatment?
And care, for sure. Well, I think it's with these advances in technology now that we can look at continuous monitoring, and they're becoming more and more common in our practice. We'll be very, very careful, and we'll be changing insulin doses based on what the glucoses are rather than treating to a hemoglobin A1C target. I think that's been the problem in the past when a lot of doctors only had the hemoglobin A1C, but now we have all these continuous monitoring data. So I think it will rely more on the glucoses, or should be relying more on the glucoses than just the hemoglobin A1C.
Well, this is absolutely a game changer, Dr. Chalou. And like I said, I would love to ask you way more questions because this is fascinating to me. We'd love to talk to you more in the future about this. Again, this is a new study that was just released, the findings. But we appreciate your time this morning and hope to talk to you again soon about this as you all learn more.
Right. Thank you for inviting me.